The Senate will soon vote on the confirmation of Robert F. Kennedy, Jr. to be the Secretary of the Department of Health and Human Services. America needs to be healthy. I'm a doctor, worked with patients for over 20 years, as a surgeon in Wyoming. The problem is our nation faces a chronic disease epidemic. Chronic diseases, including diabetes, cancer, obesity, heart disease, high blood pressure, chronic diseases. They are so widespread that managing them accounts for almost 90% of the federal health care spending in this country. And we spend a lot of our gross national product on health care. Nearly 3 in 5 Americans, adults, and 1 in 4 American children are impacted by this. Our health care system tries to address the problem, but yet by incentivizing procedures over prevention and paying for that, well, it often fails to address what we need to do effectively as well as economically. As a result, Americans are actually becoming less healthy. We need to put America on the path to good health. President Trump has selected Robert F. Kennedy, Jr. to do just that, to make America healthy again. Mr. Kennedy will bring a fresh set of ideas and eyes to important debates surrounding our nation's public health. He's going to be a voice for the vast number of Americans who were failed by the previous administration. The previous administration silenced reasoned debate. I believe that Mr. Kennedy is going to deliver accountability and transparency. For Americans, that means more choices and better information. It means healthy foods and healthy competition for patients. It means lower costs and higher quality. It means increased access to care. Access is so critical in my home state of Wyoming, with so many rural and frontier communities, people long distances from health care. It also means honest, unbiased, and trustworthy scientific research that is both innovative as well as accountable to the American people. People want the truth. They want to know what the facts are. They want to make their decisions then for themselves. Look, this is Mr. Kennedy's bold vision to revitalize America's Bill of Health. He's very clear about his mission, has been throughout. The mission, as he told the Finance Committee, is to end the chronic disease epidemic and make America healthy again. Apparently, that's not enough for the Senate Democrats. Senator Catherine Cortez Masto of Nevada, she was actually dismissive of him at the Senate Finance Committee. I heard her say to Mr. Kennedy, "So that's the only reason why you're at HHS, to address this one issue?" This one issue, chronic disease epidemic that is plaguing our nation, is the key issue to our health care. Respectfully, addressing chronic disease is what we ought to be talking about for health care for the people of our country. You know, Mr. Kennedy had to testify and did testify before 2 separate Senate committees as part of his confirmation. Most people being confirmed and coming to the Senate only testify at one committee. He responded to rigorous questions from both Republicans and Democrats, and he answered those questions with candor and with clarity. He told the Senate Help Committee that his leadership approach was collaborative. He pledged to empower the scientists to do their jobs, not to impose, as he said, preordained opinions on anybody at HHS. He was also clear that he supports vaccines. He told the Finance Committee, "I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS Secretary," he said, "that makes it difficult or discourages people from taking those vaccines." The Senate has every reason to take him at his word. Mr. Kennedy is a bold choice. He is pro-health, pro-vaccine, and pro-transparency. He's the right choice to make America healthy again. I look forward to voting to confirm him.